Thanks so much for tuning in today. My name is Jacqueline Boyd. I'm the founder of the Care Plan, where we keep you in the driver's seat when it comes to health and aging. We are a care navigation company that specializes in the needs of LGBTQ communities. As part of that work, we often support trans and gender nonconforming folks to find affirming providers. Throughout this video, you'll hear me use the acronym TGNC. When I say TGNC, I'm talking about trans and gender nonconforming folks. It can be incredibly challenging and disheartening for TGNC identified people to find care that feels humanizing, let alone competent. We've had clients report that they've been refused services, that they haven't been able to see the provider, or that the provider has made them feel uncomfortable by taking additional tests and unnecessary measures. The training for medical providers around gender identity and the care of TGNC patients is woefully limited. Many doctors receive a perfunctory lecture on diversity or LGBTQ issues maybe once or twice during medical school, and that may be the extent of their experience. If you are trying to find an affirming provider for yourself or someone else, here's some steps that our clients have found helpful. We recommend starting with your network. Find out from your friends, especially other people who may identify as trans or gender nonconforming, who they've worked with, who they've had good experiences with. News of providers that provide affirming care is often shared first within informal networks. But if you don't ask, your friends may not proactively share that information. We encourage you to use social media. Social media has vastly increased the opportunity for trans and gender nonconforming folks to connect. There are countless groups and resources on Facebook and Tumblr, in addition to individuals who share their stories and experiences via YouTube, Instagram, and Twitter. Search relevant keywords to really find others that you can learn from. Another thing that you can do is contact local TGNC or LGBTQ providers. What I mean by that is if there's a local health center, a community center, counseling practice, or business that is LGBTQ centered, you can reach out to them for resources. They may have people to connect you to. It's also important, of course, to search the web. Our go-to for TGNC affirming care across the nation is Rad Remedy. They have a database that has been vetted by trans and gender nonconforming folks. So that's really our first step when we're looking for affirming care. Throughout the process, it's important to make a list. As you're gathering information, keep a list of the recommendations you receive, and also be thinking about what else might be important to you. Call ahead of time. Before putting your money and emotional trust into someone, take the time to call their office. Ask any questions you may have to get a sense for competency. It's a good way to vet the provider and see if they'll be a good fit for you. And then you probably already know what I'm going to say, but bring an advocate. Always bring someone with you. Given the lack of training for medical providers, having another person in the room really helps minimize any negative interactions. We hope this video is helpful to you. Please share and subscribe to our channel to stay connected. If you have other tips you'd like to share, please leave them in the comment section below. Thanks, and take good care.